Thank you very much for this opportunity. I'm going to be presenting the ITTC's role in technical support in the field of drug use disorder treatment and care. My name is Associate Professor Goodwin Sbego. I'm the Director of the ITTC South Africa and Head of Division of Addiction Psychiatry at University of Cape Town. So this is an outline of what to expect in today's very brief talk. The ITTC South Africa is funded by the US Department of State through the Colombo Plan Drug Advisory Program and forms part of this international network of ITTCs that you see represented on this map. We are located within the University of Cape Town's Department of Psychiatry and Mental Health at Groote Hospital at the Neuroscience Institute. The activities of ITTC South Africa are divided into three main aims. The first aim being to support the development of national and regional drug and alcohol policies and promoting the implementation of evidence-based practices for substance use prevention, treatment and recovery services in South Africa and indeed beyond. So we do this through various activities including partnerships to take forward the task of incorporating traditional leaders and health practitioners in drug demand reduction activities on the continent. These are initiatives which were initiated by national government alongside African Union and UNODC with other partners including the South African National AIDS Council, WHO and others. We also are participating in the Global Coalition to Address Synthetic Drugs with initial contributions to our National Minister's position statement and participation in ongoing working groups. ITTC South Africa is a significant partner in co-hosting the upcoming Central Drug Authority Biennial Summit. So this initially began with participation in the provincial dialogues and has culminated in this much greater support in terms of co-hosting. We also have data policy initiatives which are at the early stage alongside Department of Social Development, Central Drug Authority and South African National AIDS Council. What we are trying to do here is to establish a centralized database or strategy for managing data which feeds into the public health data policy and strategy for South Africa, really creating improved alignment between HIV, TB, public health and substance use data. The second aim is that of expanding the uptake of evidence-based practice for substance use prevention, treatment and recovery services, including health-related conditions in South Africa. We do this through continued capacity building done both remotely and in person in motivational interviewing and screening, brief intervention and referral to treatment, as well as mental health for non-specialist workers, which includes interventions for substance use disorder at community and non-specialist areas of contact. We continue to support UTC walkthroughs both by participating in the delivery of the walkthroughs and also supporting efforts to seek funding to support future walkthroughs. The UCT Division of Addictions Care, where the ITTC is located, provides capacity building to strengthen the workforce for substance use disorders, and this includes crucially the postgraduate diploma of addictions care. We also have some research initiatives which seek to really map out the effectiveness of cascade training, as well as to really describe the impact of capacity building on service provision. We also are engaged in community engagement work in collaboration with partners such as the UCT Division of Global Surgery, and we are also now really beginning to engage in the advocacy side of things, as well as supporting the recovery networks through peer and provider capacity building. So these are new activities that ITTC has over the past year really started to gain strength. In terms of assessing and removing barriers to evidence-based practices for substance use prevention, treatment and recovery services in South Africa, the Web App Assist tool is the most significant strategy for this, and I'll speak a little bit about what we mean. And of course the Substance Use Disorder Resource Mapping project, which is underway, as well as the data initiative which I mentioned under AIM 1. Now I'll just touch on the Web App Assist to describe why we've developed this and what we hope to achieve. What does Web App Assist aim to address? Well, we're aware that there is no current comprehensive epidemiological data for mental health and substance use in South Africa. We're also aware that there's no passive living risk map for substance use in the country. We're also very much aware that there's limited funding and human resource to immediately address these needs. We also know that the current strategies include limited indicators for mental health and substance use, and Sekendo provides treatment demand data, but we still are not very clear on what the risk map is for substance use, which substances are problematic in which areas, to enable us to then advocate for appropriate mobilization of resources. The development of the Web App Assist originated from an intervention to support Department of Correctional Services. I won't go into this because of time, but ultimately we realized that the logistical challenges related to using a paper-based assist necessitated the automation of the process, including the capture of the data and the analysis of the data. Why the WHO Assist? Because it's comprehensive, includes a long list of substances, looks at risks over the past 3 months and over the lifetime, provides a level of risk for each substance, and then links that with guidance for a brief intervention. What we know is that if interventions are provided early, this reduces the likelihood of progression to worsening disease. In any event, we know that a very small proportion of those in the population will be at high risk. And so ultimately the intervention provided by the tool is in itself already assisting the population, because as we said, very few folks actually ultimately need more specialized treatment. The Web App Assist, which was then developed, is anonymized, so there's no identifying data. It's data light and can be used on any device. It's automated, actually ultimately removes training burden, and enables the exporting of the report from the screening and the intervention so that these can be stored or filed for the client. The Web App Assist can be accessed on any device using either the simple URL assistscreening.uct.ac.za or by scanning the QR code. The Web App Assist has been developed for use by individuals such as you and I for self-screening, allowing us to take charge of our own well-being, as well as use by practitioners who are able to log on using a practitioner profile, really enabling transferability of screening data between programs and facilities. We also enable special projects such as research or other special projects such as the one we have with Department of Corrections to be added as required. Some potential strategies for how the tool could be accessed. The Web App Assist was launched by the Minister of Social Development within the Faculty of Health Sciences at UCT, and the launch event was hosted on the 29th of May 2023 and attended by Department of Higher Education and Training, Department of Correctional Services, Higher Health, provincial, city and national representatives. In attendance to provide support was also the Vice Chancellor of University of Cape Town, as well as the Student Representative Council for Student of Health Sciences, amongst others. Following the launch of the tool, the next steps are really to finalize planning for integration with government information systems, linking with the geolocated resource directory under development, including the service quality measuring project which is underway under SMRC. It's also to localize some of the content and referrals advice provided by the tool, and facilitating broad use across South Africa and beyond. So these are our contact details. Please don't hesitate to reach out should you seek clarity on any of the aspects that I've presented. Thank you.